Move on to other matters. The Kenya Medical Practitioners and Dentists Union is calling on the Ministry of Health to step up its efforts in offering personal protective equipment to health workers. The union also wants the government to compensate doctors who get infected with the coronavirus to pay their hospital bills while on treatment. Dr. Mwachonda Chibonzi, who is KMPDU chairperson, says the death of their colleague has injured their morale, calling on Kenyans to know that COVID-19 is real and they should take necessary precautions. Listen in.
I think you all remember earlier on when the pandemic had been declared in our country, we raised the issue of infection amongst healthcare workers. And unfortunately, we were dismissed as fantasizers. We are doctors, and I say we are doctors because we understand disease. We understand the risk, we understand the prognosis. By the time the disease was declared in our country, we had all seen how it had ravaged healthcare workers across the globe. And I even said that there is no amount of money that will compensate a family for the loss of their loved one. It is our civic duty, it is our responsibility, especially amidst this pandemic, to take care of Kenyans. These Kenyans are our relatives. They are the people we live amongst, and we ourselves are equally Kenyans. So, just to say how personal this is, and how being the leader of these doctors, and not just doctors, and being a doctor in the society, I've had so many calls, numerous, from my colleagues, some of whom are personal friends, who have called and told me, I'd just like to tell you that I've turned positive, but I'm telling you in confidence. Or I've just handled a patient who has turned positive and I have to undergo quarantine and isolation. And this has had an effect on these healthcare workers. It is trauma that needs utmost support. And we all have a responsibility.
All right, that's the latest in terms of the healthcare workers who are in the front line. Let's